Hi, I'm Dr. Shelly Singh. I'm Senior Consultant Obstetrics and Gynecology at Rosewalk Healthcare. So today we are starting on a new journey. This is a journey where we will be carrying you through a journey of your 9 months of pregnancy. What we have decided to do is to tackle every part of pregnancy trimester wise. So, most of you would be knowing that pregnancy is made up of 3 trimesters, which are divided into 14 weeks each. So, it is the first trimester, the second trimester, as well as the third trimester. So, the first trimester begins with the time that you miss your periods, and it is till 14 weeks of pregnancy. Most of you would already know that once you miss a period, the first thing which comes to mind is a pregnancy. And I'm sure most of you would already be knowing that the first thing to do is a urine pregnancy test or a home pregnancy test. So, most of you would already be knowing that you are pregnant, but you would still like to come to the doctor so that we can be very sure that we're doing the right things. So, first of all, a pregnancy test or the home pregnancy test is fairly accurate. In fact, it is said that it is as accurate as in the, after the first day of the missed period, it may give us a positive test. But it is always better to wait for a few days to do the pregnancy test. Because sometimes what may happen is that an early pregnancy may not show up on the urine pregnancy test, and it can lead to a lot of tension and stress in case you have been planning on a pregnancy. So wait for at least 4 or 5 days to 1 week before you do that home pregnancy test. Another important thing to know is that this is a test which, as you all know, is based on a home test whereby you just take 3 drops of urine, put it in a well which is available in most of the stores, and it is going to show up as those two familiar lines which come out to be positive. So that is a positive pregnancy test. Sometimes you might find that there is only one line and it is not a very dark line compared to control. There are two parts, C and T. One is the control and one is the test. So compared to the control, the test may not show a very dark line. It may be a very faint line. Don't get scared because that too means that you are pregnant. But it's possible that it is an early pregnancy, so it is showing up as a light test. Now, this test is something which detects a chemical which is known as HCG, which is elaborated by the growing pregnancy. Sometimes you will also come to the doctor and they may confirm it with the help of a test which is called a serum beta HCG test. That's a blood test which detects the same chemical. So, in fact, sometimes this is the first test which comes out to be positive even before the urine pregnancy test. So, if there's doubt of any sort, sometimes the doctor may also order the serum beta HCG test, which is going to confirm the pregnancy. And occasionally, what happens is that we may need two of these tests, which have to be done serially, because sometimes one of the test results may not show that there is a pregnancy. Sometimes we also have to rule out other problems, which we will be talking about, like a tubal pregnancy or a miscarriage, in which we require to do a serial test, one beta HCG test, which is this blood test, which has to be done right away, and one which is to be done 48 hours later. And normally the value of this should double itself in case it is a live and a healthy pregnancy. Now, given that you are pregnant, you come to the doctor. What are the common problems that we do anticipate? First of all, your doctor is going to take the first day of your last menstrual period as the LMP. LMP is the last menstrual period, and therefore, thereafter, she will tell you what is the expected date of delivery. The expected date of delivery is generally taken as, or rather, is taken as 7 days after the LMP, and along with that add 9 calendar months. So it is 9 calendar months and 7 days. So your expected date of delivery will also be calculated. Sometimes you may be a little mistaken in your dates. Sometimes it may be a delayed conception as well. So then again, we will need to get a corrected EDD as well. Now, given that we have calculated the LMP, we have calculated the EDD, and you have come to the doctor, what are the common problems that happen in the first 3 months of pregnancy or the first trimester of pregnancy? Now, the common problems which do come about are that there can be a lot of weakness, there may be nausea, and there may be vomiting as well. You may feel that you started vomiting with food items that you used to like initially also, but now you find that you are not able to tolerate them at all. What is important is that sometimes you may also find particular tastes and smells also very toxic. You may not want to taste or smell any particular things because that leads to nausea. Apart from that, there can be a little bit of breast heaviness also, which is called breast tenderness. There may be a little lower abdominal pain as well, which is a bit similar to the kind of menstrual cramps that we have. So don't get scared even if that is happening. And you may want to pass urine again and again, which is increased frequency of urination. So these are what are the common problems which can come about. Now, what is important is let's just tackle all these little things. First, it is important to realize that the first 3 months of pregnancy, the first trimester, is a little critical. Although pregnancy is a physiological process, and I'm sure most of you would enjoy it, but first 3 months are a bit critical because this is a time when sometimes miscarriages may happen. Sometimes there are things like an ectopic pregnancy that may happen. And this is also the time when the baby's organs are forming, which is organogenesis is taking place, and therefore one has to be a little careful about some of the medicines that you can take or not take during this time. Now, what are the food items? First of all, we are not very fussy in the first trimester of pregnancy. We ask you to eat whatever you can eat because there will be nausea. We also expect that sometimes there can be weight loss that can happen. Up to 1 kg weight loss can happen in the first trimester of pregnancy because you're not able to eat well and you also have vomiting or you have nausea. Apart from that, it is also seen that you must eat small, frequent meals, whatever you feel like eating. We don't say that you push yourself to eat things, which are so-called healthy things. For instance, even milk. A lot of people have a lot of nausea with milk and they are not able to tolerate that. So there is no need to take all those things and then to vomit it all out. So whatever little you can have, small frequent meals are what definitely indicated. If you are lucky and you don't have too much of nausea, I would suggest that have lots of green leafy vegetables. Make sure you have a little salad. Make sure you have small, seasonal fruits in the form of a fruit salad, or just have a salad like that. Make sure that you're eating what you feel like eating. Those cravings also are absolutely fine. There is no need to sort of not have the food item that you're craving for. What we actually ask you to avoid sometimes is raw papaya, pineapple, Chinese food which has Ajinomoto. Too much of processed food is what is to be avoided as well. Cold drinks, I would say a definite no to. Alcohol, absolutely a no to. And it is also important that smoking is absolutely discontinued if you are a smoker. And passive smoking also is not to be done because there are various side effects because of the alcohol and because of smoking. In fact, if you want a healthy baby, which all of us do want, what is going to happen is with smoking, there are increased chances of miscarriages, low birth weight babies, preterm babies, and also other problems, for example, bleeding disorders, which can happen later on in pregnancy. something that you would have heard of called placenta previa, abruption. There are so many different things which can happen because of smoking. And alcohol also can lead to something which is called the fetal alcohol syndrome, which is characterized by facial defects in the baby, and there can also be small babies because of the alcohol that one consumes. So definitely, that's something that I am reiterating so staunchly, that you should not be taking alcohol, and go easy on the smoking. Absolutely a no-no. Apart from that, medication is an important thing that you should realize. The medicines which we do ask you to take, should everything be fine, is folic acid. Folic acid is a vitamin which is very good for the baby because it prevents developmental defects in the baby. In fact, when you're planning a pregnancy itself, 2 or 3 months prior to the whole thing, one should start taking the folic acid once a day in any case. Apart from that, if you have severe nausea, then you should be taking something which is called, there are some medications which are available to take care of the nausea as well. Some gharelu nuskhas, for instance, ginger, etc., also really helps. Apart from that, it is called morning sickness, but it can happen at any time during the day. Make sure that you can have a little bit of that ice also, which if you just keep sucking on that ice also, it takes care of the nausea sometimes. And apart from that, like I said, you can just avoid the food items which are causing the same. Dried biscuits like crackers, bread, when you take that in the morning, it is always better rather than just forcing yourself to have a lot of fluids. A lot of people are not able to tolerate fluids at this point of time, so just have a dry biscuit or dry cracker, or you can even have a toast with a little bit of butter. So these are things in which you will be helped where you are having nausea and vomiting, and of course medication is always available. Now, there is another entity which is called hyperemesis gravidarum, in which what happens is that the vomiting becomes so severe that it is ultimately going to result in loss of electrolytes, severe dehydration, and for this reason, you may even require hospitalization. So, hospitalization is also something. So, whenever you are having too much of vomiting, remember that you always tell your doctor about it so that she can at least take all the precautions which need to be taken, and at the same time treat you for the same, because occasionally this can be a very severe problem. Apart from that, now the medicines that I was talking about, like I said, most medicines are not to be taken in the first 3 months of pregnancy, because as I said, there is organogenesis which is happening. So the baby's organs are forming. A lot of medicines are not to be taken. However, some medicines are still safe in the first 3 months as well, because we don't want you to suffer also in case there's another problem. For instance, if you're having a headache, you're having body ache, you have fever, some of the medicines are safe and then can also be taken. So make sure that you're always in touch with your doctor. Most of us are responding as soon as you write in to us or as soon as you call, because there should always be a two-way communication with your doctor. Now, as I said, that this is a time where you may not enjoy pregnancy so much, because the first 3 months are a little critical and they're not very easy. How thing is that in this time, you don't really need to pay attention too much to the clothing as well as to footwear. So wear comfortable clothes, wear comfortable footwear as well. And most of the times, the precautions which we ask you to take regarding, gait, and regarding the fact that you should not be wearing heels and other things may not be applicable right now. But if you have a tendency anyways to having backaches, or you have problems while walking, it's important that you have comfortable footwear and avoid those heels at this point of time. It should be appropriate to the season. If it is the cold season like it is now, make sure that you're adequately clothed and you're wearing woolens which are warm enough. And during the summer months, of course, we want that you wear clothes which are flowy clothes. And most of the places nowadays, in our times, we did not have such good maternity wear that is available. But now we have so many maternity online sites which are also available, as well as other places where you will get very trendy, beautiful clothes which are appropriate to pregnancy. A lot of girls ask me if they can travel. So first 3 months of pregnancy, I would definitely say that if unless it is absolutely required, do not travel. And however, going from one place to another in your own city is not an issue. You can drive. There is no problem with regards to that. And you only thing is that going to another place or railway travel or travel by air. I personally feel that first 3 months you should not be doing that, although there is no contraindication. Should there be a necessity, even that is not an issue. But always talk to your doctor and find out if you can travel. Intercourse is another thing that one often is asked about. So, in the first 3 months of pregnancy, I would again advise against intercourse, although books do not say that there is a problem unless it is absolutely contraindicated. For instance, if you have a problem of bleeding during this time or there is some other issue, your doctor may ask you to avoid intercourse. However, textbook wise, intercourse is also allowed, though I would say that go easy in the first 3 months of pregnancy. So most of these things are very minor problems in the first 3 months of pregnancy, which can easily be tackled. Now, what are the investigations which one needs to do? So when you go to your doctor, the first thing that she's going to do is to calculate, like I said, your last menstrual period, your expected date of delivery, and apart from that, she is also going to ask you a complete history regarding your menstrual history, regarding personal history, even going to ask you in case there is any allergy, any addictions, any important family history that we should be knowing about, any history of diabetes in your family, high blood pressure, twinning. There are so many things that need to be found out. And apart from that, after she takes a complete history, what is going to happen is, and your particular person, past history also, which means that in case you are on some medication, in case there is some surgery which has been done, because some of them do have ramifications even on the pregnancy. If you are a diabetic, if you are hypertensive, if you have history of something which is a medical illness, all those will be taken into account, and then she will be able to actually say whether it is a so-called high risk pregnancy. So one must know from the very outset if one is dealing with a high risk pregnancy. Investigations which need to be done, there is some blood work which will be required. Some of the common blood investigations which are required are your blood group, maybe your husband's blood group, a complete hemogram. One requires to do a blood sugar test. Also, some important markers like to rule out syphilis, a VDRL test is required. HIV screening has to be done. An Australia antigen has to be screened for. Anti-HCV has to be done. Your thyroid also has to be evaluated. A rubella, whether you have actually developed antibodies to rubella will also be tested in this. Some important things like hemoglobinopathies, for example, when one is testing for thalassemia, will also be done, and a urine test will also be done. So these are the routine investigations. If there is a particular problem which is appropriate, then of course some more investigations will also be ordered by a doctor. I must reiterate the importance of the first trimester dating ultrasound or the dating scan. Occasionally, even very well-to-do and very well-educated girls will come to me and say, should we be doing so many ultrasounds? Because that's a question in their mind. Uh, you know, Remember that ultrasounds are not ionizing radiation, and in fact, they give us a lot of information. The first ultrasound should be done at around 6 to 7 weeks of pregnancy, whereby this is called a dating scan. We'll be able to date your pregnancy. Like I said, sometimes, we may have mistaken dates. We may not be sure of the dates. We may have prolonged periods. We may have other problems like polycystic ovaries, because of which we have prolonged cycles. So in those conditions, it is important that to correctly let us know what is the dating of this pregnancy, an ultrasound is done. And this is the only way in which we get to know that the little one, which is just beginning the journey in your womb, is fine. So we are able to see a yolk sac, we are able to see a gestational sac, a little sac which is there. We're able to see the heartbeat of the baby as well. Occasionally, if it's too early on in the pregnancy, we may ask you to come back to us to see that heartbeat about 7 to 10 days later as well. And God forbid, should there be a problem, for instance, if the baby is not growing well, which is called, a blighted ovum, or, which would ultimately lead to a miscarriage, or should there be a tubal pregnancy or a pregnancy which happens in the tubes, even that can be evaluated on the basis of this scan. So that's our first scan. There is another scan which needs to be done at around 11 to 13 weeks of pregnancy, which is called the NT-MB scan, which is basically it's a genetic scan. We are testing for some important genetic tests, for example, the Down syndrome, trisomy 13 and 18, because as you know, earlier on it used to be done at around 16 to 20 weeks. However, nowadays we have this test which is called the dual marker, and to that we can also add the placental growth factor screening, which will also let us know in case there is a chance that you have preeclampsia or high blood pressure during this pregnancy, and in case that is the condition, we can start off with appropriate medication like Ecosprin early on also, so that reduces the chances of the problems that come with the high blood pressure in pregnancy. So that is the NT-MB scan, as well as the blood genetic marker test which is there. And following that, of course, once one is over with these first 14 weeks of pregnancy, the nausea goes away. Most of the times, most of the problems that I have spoken to you about do get a little better. And of course, there are some other issues which crop up in the second trimester. But second trimester is the time when one actually begins to enjoy the pregnancy. I'm sure there will be someone else who will be dealing with the second trimester of pregnancy sometime later. So I hope that I have been able to at least shed some light on the first trimester of pregnancy. And in case there are any questions, in case there is anything that you would like to ask us, we're always there. Please do write in, drop in a line. I will make sure that I answer. Thank you.
I'm facing severe nausea. Please explain how can I prevent it?
Yeah. So there is a question that I'm having severe nausea. How can I prevent it? So like I told you, if you're having particular nausea to particular food items, it's a good idea to completely avoid those food items. Make sure that you have a little bit of ginger, or you can have a little bit of that even something like a amla toffee which is available. Just keep sucking on that instead of having water and lots of fluids. Make sure you can just take a little bit of an ice and keep sucking on it. And apart from that, there are some medicines which are also available, which I'm sure your doctor will tell you. There are medicines, for instance, which are safe in pregnancy, which can be given to avoid that nausea. When you wake up in the morning, instead of having, a very, very, sort of things like paranthas and all, make sure that you have something like a cracker, or you have a dry toast, or whatever, is actually helping you get over that nausea. So instead of having large meals, make sure you're having small, frequent meals. Small portions always help. and have lots of seasonal fruits and green vegetables. All that will definitely help. And in case it is still a problem and you're vomiting out a lot, then I do think that you should meet your doctor, because then we need to take slightly more aggressive management strategies.
Does the partner also have to get certain investigation?
Yes. So we do have to get some investigations done for the partner as well. For instance, the blood group of the husband should also be known. Sometimes, especially when you are an Rh negative, your blood group is Rh negative, your husband's blood group has to be checked, because in case he is Rh positive, there may be problems in the first trimester. For instance, even miscarriages can happen because of the incompatibility of the blood group. So that has to be done. A VDRL test also has to be done for the husband as well. And then, depending upon an appropriate, in case there is an appropriate issue, for instance, if your hepatitis B result comes out to be positive, then of course we have appropriate investigations even for the husband.
Okay. As you said, to prevent nausea, we can suck ice cubes. But what to do in winters?
So you can just little ginger that I'm talking about. You can have the ginger. You can have a little bit of the candy, which you can have a little candy which you can just suck, or you can even have a little bit of these amla candies which are also available. So ginger also helps. Plus, like I told you, there are medications that are available which take care of things. So some medication even do not require you to take them orally. In fact, they can just be placed under the tongue and they can just dissolve. They will help end the nausea.
I'm in my first trimester and my breast size is increasing. Please suggest what kind of bra to wear.
Yes. So, like I said, that there would be a little bit of a breast tenderness which would be there, and during pregnancy, of course, because there is more fat which gets deposited, and the body is actually preparing for lactation or for feeding your baby. Obviously, there are changes which happen in the breast as well. So you should wear a bra which probably would be a bigger size, maybe a bigger cup. It should be well fitting also, and it should be something which is not causing a lot of sagging. So well supported breast, which is of a bra which is of the right size, will definitely help you.
Okay. Constipation in first trimester.
Yes. So in case you are more prone to constipation, it is important that first of all we try and have as many fluids as one can. Whatever the nausea permits, have a lot of fluids. By fluids, I mean you could have water, you could have nimbu pani, you could have nariyal water, you could even have soup. So make sure that you're having a lot of fluids. Make sure there is adequate green vegetables in your diet. Apart from that, it is important that you can even take things like isabgol. We all know that isabgol is a plant product, so that can be taken. And there are also some medicines which are available which would take care of the constipation. So have a diet which is rich in fiber that will avoid the constipation or will reduce the constipation. Secondly, make sure you're having enough fluids in your food. And the third important thing is that even if that does not rectify things, there are some safe medicines which can be given in the first trimester also to take care of this constipation.
Okay. Severe bleeding, cramping, and pain in abdomen during first trimester.
Okay, so in case you are having bleeding in the first trimester, case you are having severe cramping as well, it is definitely a sign that all is not well. You must inform your doctor. Make sure that you get an urgent ultrasound examination done as well to make sure that you are not having a miscarriage, make sure that you do get the scan, even to be certain that it is not a tubal pregnancy. Although severe bleeding generally does not happen with the tubal pregnancy, it is generally a brownish slight bleed which happens along with abdominal pain. So an ultrasound is an absolute must. You must see your doctor. And if there is something which is called a threatened miscarriage, whereby it means that the baby is fine inside, but then you are threatening to miscarry, in that case, the doctor can also start with some medication. For example, progesterones, etc., can be started, and we may need to give you additional support for this pregnancy by some medication, including some injectables as well. Most times, this can be managed. However, since it may, portend a miscarriage also, make sure that you go to the doctor right away and get that ultrasound done.
I'm in my first trimester. Please suggest some yoga.
Okay. So, yoga basically in the first trimester, we only suggest a few stretches which have to be done. In fact, that this is one thing which I forgot to mention because I just speak extempore. Exercise is something which should be done in the first trimester. Whatever you have been doing so far, you can continue with that. But the best thing to do would be to do walking as well as gentle stretches, which can be done. As you just questioned, basically it should be under the guidance of somebody who does know prenatal yoga, and it should not be something which is contraindicated in pregnancy. So make sure that you have someone who is well equipped to handle this pregnancy yoga. Most hospitals also do have wellness programs whereby they will tell you what all can be done. But I would definitely suggest that at least do your walking for at least 5 to 6 times in a week, and at least for half an hour to 45 minutes. The only things which you have to avoid are contact sports. Even if you do swimming and all, that can be done. Light jogging is also not contraindicated, unless, of course, there is some reason why your doctor has asked you not to exercise and to take rest. For instance, if there was bleeding, like somebody just spoke about in the previous question.
What food should I avoid in first trimester?
So the food, like I told you, is there are a very few food items which we ask you to avoid. Like I said, sometimes raw papaya is not to be taken. You should not be taking pineapple because that causes a lot of irritation in the throat. Then I do suggest no alcohol. Then there should be no smoking. Cold drinks and processed food to be avoided as much as possible. Food which has sodium glutamate or Ajinomoto is to be avoided. So in case you really like Chinese food, make sure you go to a restaurant where you can order food without that Ajinomoto, or make it at home also. And apart from that, like I said, that all food which is causing that extra nausea can be avoided in the first year of pregnancy. So make sure you're having small frequent meals and lots of green vegetables and fruits as well. I would also say, one more thing is that there are some fish these days, normally fish is very good, but sometimes, I would say that sushi and other things to be avoided because it has raw fish. That's because that sometimes it does not agree very well with the first trimester.
If the vaginal discharge is foul smelling.
Okay. So, if normally, pregnancy is always associated with an extra vaginal discharge, and normally it's like a mucousy kind of a discharge because there is increased blood supply which happens to the vagina, which is part of a normal physiology of pregnancy. This becomes foul smelling. If it is yellowish in color, if it is greenish or frothy in type, or if it is causing a lot of itching, it's causing you a lower abdominal pain, or if it is associated with urinary complaints as well, It is an important thing to meet your doctor. She will just be able to see what is this kind of discharge, because sometimes it could be vaginal infections and which do require to be treated. And in fact, even urinary infections do need to be treated, especially in pregnancy. So I think we've taken all the questions which were here. In case there's anyone who would like to ask any more questions, I'll be most happy to answer those. So do write in to us, and I hope that this has been somewhat helpful to you. Bye.